Let's jump right in. Welcome to this interactive explainer. I'm your resident anatomy explorer, and today we're going on a little expedition. We're going to navigate the literal caverns of your skull to defeat the viruses, bacteria, and pollen, making you absolutely miserable. Seriously, if you've been suffering from that awful congestion, you are in the perfect place.
So why are you trapped in a stuffy nightmare? We all know the feeling, right? That dark, congested cave system causing your stuffy nose, the heavy facial pressure, that endless discomfort. Well, today, we're unlocking a secret mechanical weapon developed by Dr. Alan Mandel to fix it. We're going to learn how to physically manipulate your body's own levers to clear out that stuffy nightmare. And the crazy part is, it often works in just seconds.
Section 1. Anatomy of the blockage. Before we start our physical excavation, we need a map of the anatomical territory we're about to explore.
Okay, so our anatomical map features the four paranasal sinuses, the ethmoidal, sphenoidal, frontal, and maxillary sinuses. Now, what's really fascinating here is that these four interconnected destinations are where the vast majority of your painful blockages actually hide out. The pressure usually builds up in very specific spots, mostly right behind your cheekbones and up in the frontal region of your forehead.
As we delve deeper, we absolutely have to understand your body's internal plumbing. Specifically, we're talking about the eustachian tubes. These are vital passageways connecting the back of your nasal region directly to your middle ear. Think of them like the crucial pressure regulators buried deep within this cavernous system.
And looking at the symptoms of eustachian tube congestion brilliantly illustrates why a stuffy nose isn't just about simple nasal congestion. When this specific internal plumbing gets all backed up, it triggers a miserable cascade of symptoms. We're talking severe pain, clicking sounds deep in your ear, tinnitus, that awful constant ringing, and even vertigo, which leaves you feeling dizzy and completely off balance. It's like a giant puzzle, and it is all connected within these caves.
Moving right along to Section 2, the cheek and ear pull. It's time for our physical maneuvers.
Let's roll up our sleeves and perform Dr. Mandel's specific physical levers. I want you to follow along with me right now in this expedition. We'll start with opening the left sinus. Take your right thumb and place it securely right underneath your left cheekbone. That's your zygomatic bone. Now push it in out. While you're doing that, take your other hand, grab the lower part of your left earlobe, and pull it straight out to the side. We're doing this to manually open up that left sinus and the eustachian tube. Okay, here is the crucial point. 10 seconds. You must hold this exact position for 10 seconds. Keep pushing up and in on the cheekbone and pulling the ear out, and just freeze right there. You'll actually start to feel that left sinus physically opening up as you hold the tension. Keep holding it. Almost there. Excellent. You can go ahead and release the left side now. Now let's move to the next step, opening the right sinus. We're going to map this same maneuver onto the right side of our caverns. Switch your hands. Place your left thumb right underneath your right cheekbone and begin pushing in and out. At the exact same time, take your other hand, contact the lower part of your right ear, and pull it straight out.
Once again, freeze right there for 10 seconds. Hold that active tension as we forcefully stretch open the right sinus region to clear out the debris. Keep holding it, maintaining that outward pull on the ear and the upward push on the cheekbone. You are literally physically widening those caves.
All right, you can release your grip now, but prepare for immediate drainage and dripping. Pay close attention to what's happening inside your face. For the majority of you following along, you should instantly feel this glorious sensation of drainage occurring. That is the physical blockage finally clearing out of those caves we mapped earlier.
Section 3, the brain sinus reflex, because our physical expedition isn't quite over yet. We've cleared the manual blockages, but now we need to work the nasal region by hijacking a reflex loop directly from your brain. For this next phase, the nasal squeeze, just follow my lead. First, take your fingers and squeeze your nose completely shut. Now, take a massive, deep breath in through your mouth. Once you have that air, bring your head all the way back, tilting it up toward the ceiling. And now, hold your breath for as long as you possibly can. Seriously, hold it like you're diving deep underwater.
While you're sitting there holding that breath with your head back, let me explain the internal brain reflex because it's absolutely incredible. What you're actually doing is forcing an interconnected neurological reflex. By depriving the system momentarily and tilting your head, your brain goes into survival mode. It sends an emergency signal directly back to your sinus and nasal area, commanding those tissues to open wide. It's basically a built-in neurological trigger that forcefully unblocks the pipes.
Now for the release valve. Keep holding that breath until your body tells you that you absolutely cannot hold it for another second.
When you reach that absolute breaking point, you act as the release valve. Abruptly let go of your nose and aggressively exhale all that trapped air out as you drop your head back down to a normal resting position.
Section 4. Breathing free again. Let's see how well that worked. Now simply take a normal, natural breath in, right through your nose. Take in that fresh air and notice how it's flowing freely through your newly cleared anatomical caverns. As the architect of this incredible physiological move, Dr. Mandel perfectly describes this instant neurological and physical relief. In his own words, it's like magic. But as we've seen today on our expedition, it isn't magic at all, is it? It's just a masterclass in understanding your own anatomy.
So, how does your breathing feel right now? Pretty amazing, right? You can try performing this simple technique as often as necessary to keep those complex pathways open and draining properly. But I have to ask you, as we wrap up this explainer, aren't you amazed at what your body can fix when you just know which anatomical levers to pull? I mean, if you can control your sinuses with a simple ear pull and a breath hold, what other secret override codes is your anatomy hiding? Until our next expedition, keep exploring.